Connecticut State Dental Association is a voluntary membership organization that was founded in 1864 to cultivate the science and art of dentistry. The dentists who join our association are committed to ensuring that patients receive the highest quality of care. As part of this commitment, members from across the state have volunteered to help resolve specific types of disputes that may arise between patients and their dentists. First and foremost, the dispute must be related to dental care. This can involve allegations regarding the appropriateness of care, the quality of treatment, or billing errors. Second, the dispute must involve treatment that occurred within the last 3 years. There's an exception in situations where the same dentist has been providing treatment following discovery of a problem. This can occur when a dentist attempts to correct a problem, but the patient isn't satisfied with the results. In these situations, the 3-year filing deadline is measured from the date the patient is last seen by the dentist involved in the dispute. Third, our association cannot interfere with a legal proceeding. Therefore, we will not review a dispute that is involved in civil or criminal litigation. This includes complaints that have been investigated by a state agency. The only exception is for lawsuits involving the collection of fees. In these cases, we will agree to review a case if the dentist who filed the claim withdraws their lawsuit. Finally, our process is dependent on the voluntary cooperation of both parties. Therefore, we will only review a case if the patient and dentist both agree to participate in our peer review process. If you have a dispute that falls within this established criteria, you may submit a complaint to our association by completing 2 forms that are available on our website. An authorization for release of dental and medical information is necessary for us to review a dispute. Since healthcare information is confidential, we need your written authorization to gain access to your dental and medical records. Without this form, your dentist and other healthcare providers would not be able to discuss the care they provided or even acknowledge that you were their patient. Therefore, we ask that you list the dentist you are filing the complaint against, as well as any other dentists or treating physicians who may have information relevant to your complaint. Our other form is a request for dental peer review. On this form, you will provide your contact information as well as the contact information for the dentist you are filing the complaint against. This form also includes space for you to provide a description about the concerns you have with the dental treatment you received. Please note that while a monetary resolution is one of many possible options for resolving a dispute, a request for a refund or other monetary award may not be submitted with this form or in other written documentation provided to our association. Instead, the volunteers who work on these cases will verbally discuss these matters with you once they begin working with both parties to resolve the dispute. Once our staff receive both of these forms, we will forward the materials to a local peer review committee. The chair of the local committee will conduct an initial review to confirm whether the dispute falls within our established criteria for peer review. If it does, the chair will assign a volunteer to serve as a facilitator for this case. Since the patient has already agreed to participate in our process by submitting the required forms, the chair or the facilitator will need to contact the dentist to determine whether he or she is willing to resolve this dispute through our peer review process. In the event that the dentist declines to participate, the local committee will notify the patient that we did not receive the voluntary consent of the dentist and that we are unable to proceed with this matter. However, dentists typically agree to participate in peer review, and if we gain their consent, the local peer review committee will use your written authorization to obtain copies of your dental and billing records. The facilitator will then review the content of your complaint, the dentist's response, and the dental record before calling the patient to discuss the case. If the dispute is the result of a simple misunderstanding or miscommunication, the facilitator may be able to resolve the dispute quickly by providing some additional information to clarify the situation. This sometimes occurs with billing errors and other minor issues. However, in other cases, the facilitator may need to go back and forth between the parties for months in an effort to identify a resolution that is acceptable to both sides. It's at this point in our process that patients may request a full or partial refund, their work be redone, or that they receive reimbursement for costs related to treatment from other providers. Many cases are resolved in this manner when the patient and dentist identify an option that they are both willing to accept. When there's an exchange of money, the patient is typically asked as part of the settlement to sign a release form documenting the dispute has been resolved. While many cases are resolved at this stage of the process, there are some instances where the discussions between the parties break down. If the facilitator determines that the discussions have reached an impasse, then our volunteer may refer the case back to the chair of the local peer review committee. When this happens, the chair will contact the parties to arrange a hearing by a panel of volunteers. These hearings are typically conducted at the office of one of the panel members. The facilitator will provide a report to the panel that summarizes what they learned during the course of their review. The patient and dentist will then be interviewed separately by the panel. If necessary, the panel may also examine the patient in order to learn more about the dental treatment that was the subject of the dispute. Once this hearing is completed, our volunteers will review all of the information they received and draft a letter regarding the panel's recommendations for resolving this dispute. While this letter is non-binding, it does represent a second chance to resolve this dispute through our peer review process. However, absent any request for State Council review, we will conclude our consideration of a peer review case 30 days after the parties receive these recommendation letters. Under limited circumstances, a party to a case may file a written request for further review by the CSDA Council on peer review. Our State Council is responsible for ensuring that cases are handled in a fair and impartial manner. Therefore, the Council may review the decision of a local chair, facilitator, or panel under the following circumstances. In cases where proper procedures were not followed during the handling of their review, when the decision of the panel appears contrary to the information presented or additional information has become available which was not considered by the panel, and when there is an allegation of prejudice or bias. In order to initiate a State Council review, a party to the case must complete a request for CSDA Council review form and submit it to the Executive Director of the CSDA within 30 days from the date that the party received the panel's recommendation letter. If a matter was dismissed prior to a committee review stage, the appeal must be filed within 30 days of receiving the letter that closed the case. When a party satisfies these criteria, we will schedule a meeting of the Council to consider this request. After completing their internal review, the Council will take one of the following actions. If the Council is satisfied with how the matter was handled, they may uphold the decision of the local committee. However, if the Council believes that a new review should be conducted, they may overturn the decision of the local committee or refer it back for further consideration. This is the final step in our peer review process. Thank you for watching this overview of our peer review process. If you have any questions about our peer review process, please contact the CSDA Membership Department at 860-378-1800.